with Drew Blair.
Soon, the health and safety community will recognize Burn Awareness Week. It's the first full week in February, and it offers a great opportunity for you to teach your kids and loved ones the importance of fire and safety prevention. Here to teach us more on just that is Dr. Alan Stevens from St. Joseph Hospital's Burn Center. Thank you so much for being here this morning.
It's nice to be here.
So we've all heard that there are different degrees of burns, but what really are they? I don't know if everybody really knows what to look for.
Yes, I think probably the most simple way to think about it is a sunburn type of burn where you just see some redness would be classified as a first-degree burn. A second-degree burn would be described by some blistering. A third-degree burn is more of a leathery type of appearance, so that's probably a good way to think about those in a fast manner.
Sure, and when you are burned, your first instinct, of course, is to treat yourself. So
Absolutely.
What should people really know? When should they just say, I need to get to a hospital?
When you look at the size of a burn, that's an important indicator. If a burn's bigger than your palm, that's probably a size burn that you should go and have evaluated by a physician. Certainly if there's blistering, it's reasonable to do that as well. If the pain is not improving over a 24-hour period, that's another indication that you probably ought to be evaluated by a physician.
Sure. Now, we hear a lot of times of this term smoke inhalation. What is that? Is that actually considered a burn?
Well, it can be. Smoke inhalation is best described as the inhalation, the breathing of poison gases, which can be toxic and ultimately can be fatal if enough oxygen is replaced by the toxic inhalation vapors.
So what are some of the most basic safety tips people really need to keep in mind?
Well, since the viewers are just settling down into the kitchen this morning with the hot coffee and with the hot chocolate, it gives us an opportunity to talk about one of the main themes of the Burn Awareness Week, which is scald prevention. At the outpatient clinic at St. Joe Hospital, we see about 800 patients a year. About 1/3 of those patients are actually under the age of 5 years, and the majority of those patients tend to be children with scald burns. So while we're in the kitchen, we need to think about the simple things: lids on the cups, keeping a safe distance between hot liquids and children or even older adults. And those are things that can keep us safe in a very simple way.
Sure, and just adult supervision at all times when working in the kitchen with the young kids.
That is key.
All right, Doctor, thank you so much for being in here this morning. I'm sure we'll learn much more about all that we need to know during Burn Awareness Week coming up in a little bit. Thanks again.
You're welcome.